Hello everyone, welcome to sqadia.com. I'm Hina Khan and today the topic of our lecture is depression. So depression basically is a severe medical illness that comprises of a feeling of dejection, and it's basically a medical and a clinical representation, and usually the patient even acts in a dejected way in such a condition. So we'll be studying what are the clinical presentations of depression, how a patient presents in an OPD if he or she has depression. So these are the sections basically that we'll be discussing. First of all, we'll be discussing the clinical presentation because that's quite important over here. A detailed history involving any psychiatric illness is very important. That is the basic difference between psychiatry and the other medical fields, that the history is the mainstay over here. And so taking a detailed history along with history taking from the relatives and the close social circle is quite important if you want to make a diagnosis of depression. Then anhedonia and anergias, these are the basic terminologies that are revolving around depression when we're talking about it. And so we'll be discussing them. What do you mean by these terminologies and how do you define that a person is suffering on depression if he is having these anhedonias, that is basically the feeling of less pleasure in the activities which he found to be pleasurable previously. So depression in older adults is quite a common phenomena because in older age people are more prone to be in a depressed phase because of their loneliness, and there are a lot of other socioeconomic factors that are revolving around this phenomenon. In the second section, we'll be dealing with the risk factors primarily. So the socio-demographic factors and the socio-economic factors, they form the foundation for this medical illness. Then we have the psychosocial and as well as the biological factors. So even the gender discrimination that is revolving around depression is due to these biological factors that basically differ from male to female and even from younger age people and people in the adolescence or even if they are in their older age. So the psychiatric co-morbidity will be discussed over here in this second section. Moreover, in the third section, we'll be discussing the diagnosis as well as the assessment. How do you assess a patient of depression? You're going to grade the disease, obviously. It's going to be a milder form, it's going to be a moderate, or it's going to be a severe depression. So basically, the management lies upon this grading phenomena, so it's quite critical how you grade the patient. The assessment and differential diagnosis, obviously, there are some other phenomena that resemble the sign and symptoms of depression. So how do you basically give a differential diagnosis to a patient who has the symptoms of depression? Then we have the etiological models of depression that we'll be discussing in this third section. Moreover, in the fourth section, we'll be discussing the management of such patients with depression. Primarily, we'll be discussing the general principles of any patient, whether he's suffering from a milder form or whether he's suffering from a severe form of depression. What are the general rules that we follow while we are treating such a patient? And then we'll be discussing the specific treatment modalities that are held on to when we are dealing with the mild, moderate, or the severe forms of depression. So we'll be dealing with the recurrent depression. So it's another terminology, and obviously it occurs in people who are more prone to such kind of an ailment. So I hope you want to learn more about depression. So do watch the other sections to this lecture as well.